welcome back to Tuesdays with Timeless. I'm Dr. Stephanie Christian. Today, I'm going to talk about the treatment of face veins. Those red and blue veins that can really appear anywhere on the face. The red ones are called telangiectasias, and they tend to be fine, and they can appear sort of spiderwebby or like a delta from a river. Over time, they can get a little bit bigger and they can look more like a spider vein on the leg. They're most common on the nose, the cheeks, and the chin, and occasionally on the forehead. We see them most commonly on fair-skinned people who've had a lot of sun damage or who have rosacea. If they are very prevalent everywhere on the face, then I recommend that someone see a medical dermatologist or their internist because they need to be evaluated for possibly having lupus or scleroderma or dermatomyositis. The other ones are the blue veins, and they can show up in a number of places. They're very common under the eyes, and they're one of the things that can contribute to dark under the eye circles. We also occasionally see them on the nose, and some people have them deep in the skin in sort of vertical lines here next to the mouth and laterally on the cheeks. So how does laser treatment of face veins work? Well, like all laser treatments, we choose a specific wavelength for the laser, and the laser puts out light energy in that wavelength to target that thing that we want to treat. When that light energy hits that target, in this case, hemoglobin in those face veins, the hemoglobin converts the light energy into heat, and heat is our tool. In the case of face veins, that heat causes thermal injury to the vessel and seals it so that blood can't flow through it, ultimately leading to the destruction of the vessel, and then the body reabsorbs the vessel so that it won't be there anymore and we won't be able to see it. Now remember, these are abnormal vessels. These aren't the good vessels that are carrying oxygen to the skin. Those vessels we can't see. These are abnormal vessels that developed for some reason. So what does it feel like? Well, it's heat-based. Remember, heat is our tool. So it feels a little stingy or like there's a hot rubber band snap. And so the two lasers that I use to treat face veins have a cooled tip, and the laser travels through that cooled tip. That cooled tip does two things. First, it's cooling the skin before and after, or before, during, and after the laser pulse, so that it helps prevent any kind of heat injury to the skin that's not the actual vessel itself. And it helps diminish any kind of heat discomfort to the skin. Most adults find this very manageable, but if someone comes into the office and says, I can't deal with any kind of discomfort, I will offer them Pronox. I think it's one of the things that sets our practice apart because these are elective procedures, and I don't really believe that this is a no pain, no gain situation. Pronox is nitrous oxide, and you've probably heard those words in a dentist's office. It's what dentists use to help relieve anxiety and pain. In our practice, it's delivered a little differently. It's patient administered. So you take some breaths, usually the same number of breaths that we've asked you to take, or sometimes we'll just say, take as many breaths as you need, and then you drop it. So you don't have it administered all the time. You take as much as you need, or as much as we think you're going to need, and then you drop it. And nitrous oxide does two things. One, it's an analgesic, so it takes away pain, but two, it also takes away anxiety. And for a lot of people, anxiety is the biggest part of their pain perception. The next question is, who is not a candidate for laser face vein treatment? And the first is people who have hereditary hypersensitivities to light. And you would know that well before you became an adult. Or people who are taking medications that make them hypersensitive to light. And once again, you would know that because the doctor who prescribed the medication would tell you that. The third category is people who have seizures that are triggered by light. And once again, you would know that. And the third is people with very, very dark skin who might get hypopigmented by certain wavelengths. Not all wavelengths, but certain wavelengths. So that would be a person who I would need to see to evaluate. I can treat some vessels, but not all vessels. And so I would just need to see them. The next question is, what does it feel like after the treatment? Well, after the treatment, there's sort of a sunburny feeling, and intermittent application of an ice pack really helps. There's some redness that can last for a couple of hours. There is often swelling, especially if I've been treating vessels right under the eye. And if this is someone who frequently has eye swelling from allergies, I will often pre-treat them with a medical cocktail that works really, really well. For swelling, sort of generalized swelling on the face, we have dietary, product, and medical suggestions that tend to work very well. There is a small possibility of bruising. It doesn't happen very often, but we have product recommendations for that. There is a very rare possibility of crusting. It's not whole face crusting, but it may be one or two of the spots that happen. And like I said, this is very rare. And we also have products that work really well for that. Everyone should be using a zinc-based sunscreen from hairline to nipple line, but you especially want to use it where we have been treating the blood vessels, because in that process of shutting down the vessel, there is going to be some debris from the breakdown of the hemoglobin and the breakdown of the vessel. There are going to be inflammatory cells coming in to take away that debris, and inflammation plus sun makes hyperpigmentation, and we don't want to replace either blue or red with brown. So it's really important to use a zinc-based sunscreen. What about activities? Well, you can resume most normal activities right away, but I always caution people not to do any kind of strenuous exercise. I mean, what we're trying to do is seal off that vessel. Strenuous exercise is going to force blood through that, and it's going to completely undo the whole purpose of the procedure. So I recommend that people don't do any kind of strenuous exercise for 24 to 36 hours after the procedure, even for ones on the face. For most people, it takes one or two, but there are no two faces that are the same. So I think probably the safest answer for that is that the number of treatments depends on the size, the location, and the number of vessels. Will they come back? Well, a vessel that has been destroyed will not come back. But if you are genetically predisposed to make these vessels, we haven't changed your DNA. So if you are still exposing yourself to sun, if you have rosacea and you're still exposing yourself to your triggers, chances are you will get more vessels down the line. But we can treat those, again, with laser vascular treatment. So I hope this answers some questions. Once again, if you have any comments, please comment below. I always like that feedback, and I will always answer those questions. Stay well, and I'll talk to you again next week.